Come on this way. My name is Brenda. I've been a registered dental assistant working for the government in El Paso, Texas for over 8 years now. I'd like to talk to you today about reasons of why, if a trusted dentist, someone whom you totally trust and have likely been seeing for years, suggests that you have a tooth extracted, if it would be wise to have it done instead of putting it off. I've assisted several of our dentists caring for thousands of military patients during that time for over 8 years. Some of these patients have needed to have one, a few, or sometimes many teeth extracted by us. I've personally assisted many of these extraction procedures. I'd like to briefly tell you today about why you would likely be a really wise and smart patient to have a tooth or teeth extracted if your trusted dentist recommends it to you. First of all, there's always a very good reason why the dentist suggests to you to have an extraction done. I'm going to give you a couple of reasons of why perhaps it's suggested to have an extraction done. As www.yourdentistryguide.com online explains, a common reason you may need an extraction done is because your tooth is severely decayed. That means that you have what the dentist may call rampant caries. In easy to understand language, this means you have a really, really big cavity, and it's not going to get any better, and there's no way to save your tooth because over half of your tooth right now is literally one huge cavity. Another reason why you may need to have an extraction done is because you recently suffered trauma to your face and mouth, and your tooth is now loose as a result. The trauma you suffered may have been, for example, from a car accident, from military trauma, or if you fell down and hit your mouth. Or perhaps you may have lost your balance accidentally, like if you got up in the middle of the night to get a glass of water, or you may have rolled out of bed and hitting your mouth as a result if you had fallen when that happened. Or you may also have had a seizure and fallen, knocking your teeth loose as a result. These are all real live dental stories I've personally heard from patients throughout my assisting career so far. As www.webmd.com online explains, if a tooth is infected, then it should often be extracted. If the tooth decay or damage goes into the pulp chamber, which is the center of the tooth which contains blood vessels and nerves, then bacteria in the mouth can enter the pulp, leading to infection. Sometimes the infection can be corrected by having a root canal done or with antibiotics. However, if the root canal does not work, then an extraction will be needed to stop the pain the infection is causing you as the dental patient. Health USA News Online advises to have your wisdom teeth removed. The suggestion to have these teeth extracted when you're young preferably are teeth numbered 1, 16, 17, and 32. The reason that they're likely suggested to have these teeth removed is because they may be impacted, which may lead to an infection. These wisdom teeth can also cause decay on the adjacent teeth. They can cause gum disease, or they may be interfering with your bite, and you may be biting your cheek as a result. One last but also very important reason as to why you may need to have an extraction done, as mentioned by www.colgate.com online, is if you are receiving radiation to the head and neck for cancer. In this case, you will likely need to have teeth in the field of radiation extracted. If you were recently advised by your dentist to have a tooth extraction done as a patient, you likely came up with a few ideas yourself about why, which you think are good reasons of why you just don't want to have an extraction done right now. And you're seriously contemplating and thinking about not having your extraction done in the near future. Your reasons may include the following. Your tooth isn't hurting now, so you're thinking, well, why should I have an extraction done if my tooth isn't even hurting me? First of all, your dentist can tell by looking at the x-ray, and he can totally show it to you, and he should show it to you, your big cavity or the definite reason of why you need the extraction. So your dentist always wants to save your teeth. He doesn't desire to do extractions on you, but if he's saying it needs to get done, then it really does need to get done. The reason why you should have an extraction done before it is hurting a little bit or before it's hurting a whole lot is a truth that I share with our patients all of the time. Quite honestly, our local anesthesia works best if you are not already in dental pain the day of your extraction. So it's best to totally have an extraction done before your tooth is hurting you. Another reason why you may be thinking about putting off an extraction date, you may be thinking, well, and I hear this all the time, it's almost the holiday season, and I just don't think it's a good time for an extraction right now. Well, actually, in reality, the best reason why you should have your extraction done right now before the holiday season is because you don't want your tooth to start hurting you during the holiday season when all of the dentists are off on vacation. Because they take weeks off at a time, almost all of them around the holidays. All the holidays, it doesn't matter what holiday. So this happens often. So during like the Christmas break, we'll have a couple of patients that will come in during sick call on an emergency basis where they were treatment planned a long time ago to have extractions done, but they haven't had them done because they just didn't want to. So it's wise to have an extraction done when your dentist suggests it. So I'm just going to show you real briefly about what you can expect when an extraction is done. This won't take very long. So you'll come into the dental chair right here, and you'll sit down. We'll take your blood pressure. We'll ask you if you're on any blood thinners such as warfarin, Coumadin, or aspirin. And if when you bleed, if you should stop regularly or if it's going to take you a long time to clot. We'll then give you what's called an IMED consent, and we'll have you read that, and then we'll have you sign it right here on the computer where I'll bring it to you at your desk, here in your chair. And I'll first of all go over it with you, the IMED consent. It's about 4 pages long, and it's explaining to you exactly what the dentist is proposing to do concerning extracting your tooth. We'll also show you a mirror right here before you sign this consent form so that you can see exactly. We'll have you open up your mouth, and we will point to, and we'll also mark it with a purple marker as far as you know exactly 100% which tooth is going to be extracted. Okay, the doctor will then come in and they'll talk to you about the extraction, the reason for the extraction, and make sure that you totally understand the reason of why you're having an extraction, as well as what they propose to do after the extraction is done, after you're healed, as far as to replace that missing tooth that you're going to have in your mouth where the tooth socket will be. Okay, then fill in the IMED consent form on the computer, and we'll write in that the doctor is going to anesthetize and extract the non-restorable along with the tooth number. For instance, if it's like number 1, I would write in your IMED consent to be saved to your chart to anesthetize and extract non-restorable tooth number 1. Okay, so then I'll bring you the pencil, and then you'll sign it, and then I'm going to save it to your computer chart. Your doctor is then going to give you a timeout where you have a couple minutes to think about it, make sure you're okay with going ahead with this. And then she'll ask you your birth date, your social security number, if you're aware of exactly what's going to happen. And then what will happen next is the doctor's going to place some topical to start you getting gently numbing. She'll then give you our regular local anesthesia, the same anesthesia that we use if you come in to have restorations done, or a bridge prep or a crown prep. And then we'll give you a couple of minutes to, for that anesthesia to set in. And then she'll start gently probing, and then in the end you're going to have your tooth extracted. She'll then clean you out really nice, and then as far as where your tooth was in your tooth socket, and then she'll rinse with some sterile water, and then you'll leave with a couple of gauze in your mouth with some really good directions. These are the directions right here we're always going to give you to go home with. Right here, the assistant will go over these really good so you know what to expect, what to eat, as far as what to do if you're in pain for the next couple of days. And also as far as if you have any sutures in your mouth and if they should need to be removed at a certain time. Okay, we'll also plan your next scheduled visit so you know what's happening next. Okay, thank you so much for watching me. I really appreciate it, and have an awesome day. Bye-bye.